High blood pressure, often called the silent killer, affects millions. Many don't even know they have it. Today I'll show you 10 crucial warning signs your body gives when your blood pressure is dangerously high, signs you can't afford to ignore. Let's start with severe headaches. These aren't just the typical headaches you might get after a long day or from staring at a screen for too long. We're talking about headaches that feel overwhelming, almost unbearable, and come on with a force that's hard to ignore. Not your usual tension headache. This is sudden, intense, and different from anything you've felt before. It might feel like a thunderclap striking out of nowhere, or a deep throbbing pain that quickly escalates. Often, the pain is centered at the back of your head or neck, and no matter what you do, rest, hydrate, or even take over-the-counter painkillers, nothing seems to help. The discomfort lingers, and you might notice it's much worse than any headache you've had in the past. Liking our video so far? Before we move on, don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative videos. When your blood pressure spikes to dangerously high levels, it puts immense strain on the blood vessels in your brain. This increases the risk of a hemorrhagic stroke, where a blood vessel bursts and causes bleeding in the brain, a life-threatening situation. If you experience a headache that's unusually severe, comes on suddenly, or is paired with other symptoms like confusion, trouble speaking, weakness, or vision changes, don't wait to see if it passes. These are red flags that something serious could be happening. Check your blood pressure immediately if you have the means to do so at home. A high reading, especially if it's much higher than your normal, is a clear sign you need help. If your blood pressure is elevated or the headache persists, seek medical help right away. Don't try to tough it out or wait for it to subside. Quick action can make all the difference. Remember, your brain is your command center. It controls everything you do, think, and feel. When it sends out distress signals like a severe headache, it's crucial to listen and respond. Severe headaches can be your body's way of warning you before a crisis hits. They're not just a nuisance, they can be a sign of something much more serious, like dangerously high blood pressure or an impending stroke. Take them seriously, and don't ignore what your body is trying to tell you. Acting quickly and seeking help could save your life, or the life of someone you care about. Always err on the side of caution when it comes to severe headaches. Next, watch for sudden vision problems, blurred vision, double vision, or sudden loss of sight. These symptoms can appear unexpectedly and may be alarming. They often indicate underlying issues that need immediate attention. Imagine trying to read a book or watch television, and suddenly, everything becomes a blur, or you see two images instead of one. This can be disorienting and frightening. High blood pressure can damage the tiny vessels in your eyes, leading to hypertensive retinopathy. This condition occurs when the force of your blood flow is too high, causing the delicate blood vessels in your retina to become damaged. Over time, this can lead to serious complications, affecting not just your vision but your overall health. You might feel like you're looking through fog or see double. This sensation can make everyday tasks challenging, from driving to simply walking around your home. It's as if a veil has been drawn over your eyes, obscuring your view of the world. These changes mean your blood pressure is high enough to cause organ damage. It's a warning sign that your cardiovascular system is under stress, and it's crucial to address it promptly. Ignoring these signs can lead to more severe health issues down the line. If left untreated, it can lead to permanent vision loss. This is not just a temporary inconvenience, it's a potential life-altering condition. Vision is one of our most precious senses, and losing it can significantly impact your quality of life. Your eyes are a window to your vascular health. Damage here often means damage elsewhere. The state of your eyes can reflect the health of your entire body, particularly your heart and blood vessels. It's a reminder that everything in our body is interconnected. If you notice sudden changes in your vision, get your blood pressure checked and see a doctor. Don't dismiss these changes as minor or temporary. They could be the first signs of a more serious condition that needs medical intervention. Don't wait for it to get worse. Time is of the essence when it comes to preserving your vision and health. The sooner you act, the better your chances of preventing further damage. Protecting your sight starts with controlling your blood pressure. Regular monitoring and medication, if necessary, can help keep your blood pressure in check, safeguarding your vision and overall health. Early action can prevent lasting harm. By addressing the issue promptly, you can avoid the long-term consequences of high blood pressure on your vision and health. Don't ignore what your eyes are telling you. They are sending you a message about your health. Listen to them and take the necessary steps to protect your vision and well-being. Chest pain is a classic warning sign. It may feel like tightness, pressure, or squeezing in the center of your chest. This pain, called angina, means your heart isn't getting enough oxygen. High blood pressure forces your heart to work harder, straining it over time. Pain can radiate to your arms, back, neck, or jaw. Any new or worsening chest pain, especially with shortness of breath or dizziness, is a medical emergency. Don't try to tough it out. Call emergency services immediately. Your heart is under stress, and this pain is a direct warning. Immediate action can prevent a heart attack. Never ignore chest pain. Shortness of breath, especially when it happens at rest or with very little activity, is a serious red flag that should never be ignored. It's not just about feeling winded after climbing stairs or exercising, it's about struggling to catch your breath even when you're sitting still or doing something simple, like getting dressed or walking across a room. High blood pressure, also known as hypertension, can silently damage your heart over time. When your heart becomes weaker, it can't pump blood as efficiently as it should. This causes blood to back up into your lungs, making it harder for oxygen to get where it's needed. As a result, fluid can start to build up in your lungs, a condition called pulmonary edema. This makes every breath feel like a struggle, as if you're trying to breathe through a straw. You might notice a persistent cough, wheezing, or a feeling of tightness in your chest. Many people find they need to prop themselves up with extra pillows at night just to breathe comfortably. Some even wake up suddenly, gasping for air, feeling panicked and unable to catch their breath. These nighttime symptoms are especially concerning and should not be brushed off. Remember, this isn't just about being out of shape or getting older. Shortness of breath like this is a clear sign that your heart is struggling to keep up with your body's needs. It's your body's way of telling you that something is seriously wrong. In fact, shortness of breath is one of the most important warning signs of possible heart failure, especially when it's caused by uncontrolled high blood pressure. If you notice this symptom, it's crucial to take it seriously and talk to your doctor as soon as possible. If your shortness of breath is new, getting worse, or happening more often, don't wait. Seek medical help right away. Quick action can prevent complications and may even save your life. Don't make the mistake of dismissing these symptoms as just a normal part of aging or a lack of fitness. Ignoring them can be dangerous, and waiting too long can make treatment more difficult. Pay attention to what your body is telling you. If you're struggling to breathe, feeling unusually tired, or noticing swelling in your legs or ankles, these could all be signs that your heart needs help. The good news is that early treatment can make a huge difference. With the right care, many people see their symptoms improve and their quality of life return. Don't ignore your breath. Listen to it and take action. Remember, recognizing the signs and seeking help early could truly save your life. Your breath matters. Don't take it for granted. An irregular heartbeat, palpitations, fluttering, or skipped beats can be a sign of high blood pressure. Hypertension stresses your heart's electrical system, leading to arrhythmias like atrial fibrillation. AFib increases your risk of stroke fivefold. You might feel your heart pounding in your chest or neck, sometimes with dizziness or chest pain. Occasional skipped beats can be normal, but frequent or sustained irregular rhythms are not. If you notice these symptoms, get checked by a doctor. An EKG or heart monitor can diagnose the problem. Early intervention can prevent serious complications. Don't ignore your heart's warning signals. Your rhythm matters. Persistent fatigue or confusion can signal high blood pressure affecting your brain. This isn't normal tiredness, it's exhaustion that doesn't improve with rest, or a mental fog that makes daily tasks hard. High blood pressure can damage brain arteries, reducing blood flow and impairing function. In a crisis, confusion can be sudden and severe. Don't dismiss these symptoms as stress or aging. If you or someone you know experiences unexplained fatigue or confusion, check blood pressure and seek medical advice. Protect your brain by acting early. Your clarity and energy depend on it. Blood in your urine, hematuria, is a serious warning. High blood pressure can damage the tiny vessels in your kidneys, causing them to leak blood. Your urine may look pink, red, or cola-colored. Even if you can't see it, lab tests might detect it. Damaged kidneys can't regulate blood pressure, creating a dangerous cycle. This can lead to chronic kidney disease or even kidney failure. If you notice blood in your urine, see a doctor immediately. Don't ignore this visible sign of internal damage. Your kidneys are vital. Protect them. Frequent or severe nosebleeds can be a warning sign, especially during a hypertensive crisis. High blood pressure can cause the tiny vessels in your nose to rupture. While not every nosebleed is serious, a pattern of spontaneous or hard-to-stop nosebleeds should prompt a blood pressure check. If nosebleeds happen alongside other symptoms like headache or dizziness, it's even more urgent. Don't brush them off. They could be your body's alarm bell. Take action if they become frequent or severe. Feeling a pounding or throbbing in your chest, neck, or ears is a direct sign of high blood pressure. This isn't fluttering. It's a strong, regular, forceful beat you can feel or even hear. It's your heart working overtime to push blood through stiff arteries. If this pounding is new or intense, check your blood pressure. If it's paired with chest pain, headache, or shortness of breath, seek help immediately. This is your body's drumbeat of distress. Don't ignore it. It's a real-time warning. Dizziness or lightheadedness, feeling unsteady, like the room is spinning or about to faint, can signal dangerously high blood pressure. In a hypertensive crisis, blood flow to the brain is disrupted, affecting balance and coordination. If you're not on medication and experience new or worsening dizziness, check your blood pressure. If dizziness comes with headache, vision changes, or confusion, it could be a medical emergency. Don't ignore these episodes. Your body is warning you. Act quickly to prevent serious complications. These 10 warning signs are your body's way of asking for help. Don't ignore them. If you experience any of these symptoms, especially if sudden or severe, consult a healthcare professional immediately. Regular blood pressure checks are your best defense. Know your numbers, even if you feel fine. Early action can prevent life-threatening complications. Take charge of your health today. Please don't forget to subscribe for more wellness tips. We'd also love to hear from you by sharing your thoughts with us in the comments below. Thanks for watching. Stay healthy and stay curious.